All right, so the lymphatic system is a system in which it drains down your lymph. Okay, so what is lymph? Lymph is actually fluid that is on your interstitial tissue. And remember, whenever there's fluid produced by your body, it will have to go back to the brain. Okay, so we saw that with the cerebrospinal fluid. The fluid that is produced by your brain is drained back to the brain. Okay, and this is what we have for our lymphatic. The fluid out of tissue will always be drained back into the vein. Okay, and these are the structures, the lymphatic vessels, and the main component of the immune system, which is actually the cells that are located there, could be the lymphocytes. And we have tissues, lymphoid organs, and lymphoid tissue. That is where those lymphocytes are located at. But the fluid that's on your tissue is going to be drained by the lymphatic vessels. So we're going to be looking at the lymphatic vessels. What are the components of lymphatic vessels that drains the fluid? Now, here is a lymphatic system, okay? Now, remember, the lymphatic system, okay, is a fluid that is produced by the blood vessel. Remember, some of the blood vessels, the components of the blood vessels, the fluid from the blood vessels will go into the tissue, and the fluid will then have to be drained back into the lymphatic vessels. And if the blockage, there's going to be a blockage for the drain, what's going to happen is there's going to be edema or swelling within the tissue. Okay? So we have to follow the drain. And then if you notice that the drain enters into the venous system. So they're going to drain back into the venous system. So lymphatic vessels collect the tissue fluid from the loose connective tissue, okay? And they collect it and they carry fluid back to the great veins in the neck, mainly the subclavian vein. So they usually drain into the subclavian vein. Okay, and the flow now of the fluid after it's drained to the subclavian vein, it'll then go into the heart. So it'll follow the venous drainage down to the heart, specifically the right atrium, then it goes through the chambers. Now, the function of the lymphatic system, they collect the excess tissue fluid. So these are excess tissue fluid and blood proteins also. Okay, so because that's located in your lymph. Lymph means fluid, okay? And it turns it back into the bloodstream, right? So if you take a look at the anatomy of the lymphatic system, you'd start off with the lymph capillaries. So within the capillaries, so the capillaries have leaks, okay? It leaks the fluid down to the tissue, and then it leaks down to the tissue. You would actually have to carry it back to the vein. So the first vessel that will take the fluid is what we call the lymphatic capillary. So lymphatic capillary will drain the fluid, and then from there, it'll then go into the collecting vessels. And those collecting vessels are the one that has valves with drains down into the lymph nodes, okay? So the lymph nodes is an organ in which it has a lot of lymphocytes. So whatever passes through the lymph nodes will be filtered out by the lymphocytes. So remember, some of the fluids may have organisms there. And then when it passes through the lymph nodes, it will be then filtered out by the lymphocyte. And not just microorganisms, okay? Remember, if somebody has breast cancer, cancer cells around this area, okay, some of the cancer cells can travel down to the lymph capillaries. And it's a good thing that it will be stopped by the lymph nodes, okay? So lymph nodes will try to kill those cancer cells. Remember, the most common organisms that lymphocyte would actually kill is cancer cells, virus, and fungus, okay? So the bacteria is being handled by your other white blood cells called the monocytes, neutrophils, and basophils. Now, if the virus, cancer cells, and fungus is carried by the lymph, then the lymph node will filter it out, okay? So there's a lot of lymph nodes that guard around our body. So those are strategic nodes located around the body to protect us. Now, if the lymph nodes filters it out, so whatever goes into the next structure called the lymph trunk, that should have been clear of those cancer cells, virus, and fungus. Okay. Unfortunately, sometimes the cancer cells are still traveling down to the lymph trunk. Okay. When it goes to the lymph trunk, it will then drain into the lymph duct. And then from the lymph duct, it will go into the venous system, the subclavian vein. And it will travel to the heart and to the circulation. Okay. Now, this is what we call metastasis for cancer. That's the reason why cancer cells can metastasize and travel to other organs. Because if they weren't filtered out by the lymph nodes, the cancer cells will seed into other organs such as the brain, the bone, and the liver. And once they seed into the brain, bone, and the liver on organs, okay, on distant organs where the cancer cells started, that is can be called metastasis. That is stage 4 cancer. Okay, and remember, stage 4 cancer is the end of the of cancer treatment, because so most of those cancer metastasis is inoperable, especially when they go to the brain. When they seed the brain, cancer cells will grow into the brain, and then it's going to be hard to operate on that. Okay, and that is how we should consider the lymphatic system as a way to use it in terms of clinics. Okay, so when we see cancer cells in the lymph nodes, so we do a biopsy of the lymph nodes. Like for example, the breast cancer, okay, can actually travel to the lymph nodes located at the armpit, and that is called the axillary nodes. And then we biopsy the axillary nodes. If there's positive cancer cells there that is on the axillary nodes, then we stage it as stage 2. Okay, so stage 2, and then if we go and take a look at your cancer cells, if they seed to distant organs, that is stage 4. Okay, so this is the thing that we use for the clinical aspect of the study of the lymphatic system. And the main purpose of the person that has cancer is to kill it up where it is, the primary site. So primary site, like for example, breast cancer, if we see a lump there, then that is stage 1. So we just take the lump, we call it lumpectomy, and then we biopsy the other lymph nodes. If the other lymph nodes, the lymph nodes that are located in that area called the axillary nodes, they're negative of the cancer cells, then the patient does not go to stage 2. Okay, if we saw cancer cells on the lymph node, and then we are anticipating that already seeded up into the venous system, and that's the reason why we do chemotherapy. Chemotherapy is to make sure that the cancer cells are not inside your blood vessel, because they can seed into the other organs such as the brain, bone, and the liver. And that is the reason why we use chemotherapy as a tool in order to kill those cells that have possible spread into the blood vessel from the positive lymph nodes. Okay, and that's exactly the reason why we know the method of treatment. If it's stage 1, we just do a lumpectomy. Okay, and then radiation on the area where we do the cancer lumpectomy. Okay, but if it's stage 2, we now institute a treatment called chemotherapy, because chemotherapy can track down those cancer cells that are still inside the circulation. We want to prevent it to seed into the distant organs. Okay, so this is the concept of cancer treatment. Okay, so staging is what we do when we do cancer treatment. Okay, so those are the lymphatic system in order. Okay, we started out from the lymphatic capillaries or the lymph capillaries, and then it's drained to the collecting vessels. And then from there, it's drained into the lymph nodes. And then from the lymph nodes, it drains to the lymph trunks. And then from the lymph trunks, it now goes to the lymph duct. And then from the lymph duct, it will go to the subclavian vein. And then it actually gain access to the subclavian vein. Now it's going to be going to the circulation. Okay, and remember, if it's floating on the circulation, now we have a big problem, because we know that it will metastasize to distant organs, when most common areas that metastasize is liver, brain, and bone. Okay, so that's actually the cancer theoretics, right? So here are the different vessels, okay? So we started from the lymphatic capillaries, okay? They're usually located near blood capillaries, okay? And they receive tissue fluid from the connective tissue. So the fluid coming out from the capillaries will then seep out into the pores of the blood vessel. Remember, blood vessels have pores. And that fluid is seeping out into the tissue. And whatever is accumulated in the tissue has to be drained back into the lymph capillaries. Okay, the lymph capillaries would then push it to the upper vessels. So an increase in volume of the tissue fluid will open the flaps located at your lymphatic capillaries. Okay, so the hypermobility allows entrance of the tissue fluid into the lymphatic capillaries. That includes bacteria, virus, and cancer cells. So the fluid is the main purpose of the drain, but somehow you can have some bacteria and some viruses and cancer cells. If there exists one, that will be following that fluid. Okay, so remember, another thing, when we study the digestive system, the lymphatic system is called lacteals. Inside your digestive system, the small intestinal tract, you're going to have lymphatic capillaries. And the purpose of the lymphatic capillaries is to absorb the fats. Fats does not go into the blood vessel from the absorption through your intestinal tract. Fats, when they become absorbed by the intestinal tract, they go through the lymphatic capillaries. Okay, they're located along the villi of the small intestine. So we'll see that when we actually study the digestive system. And this is where they receive digestive fats. So they travel to the digestive fats. But remember, the digestive fats travel to the lacteals, or what we call lymphatic capillaries. Then they gain access to the blood vessel, the subclavian vein. So eventually the fats will then mix up with the systemic circulation. So the fatty lymph that is absorbed through the intestinal tract, okay, from the lymphatic capillaries, we have a special name for that fatty lymph. We call it chyle. Okay, that's going to be chyle. We're going to go back to that when we study with the digestive system. So we went through the lymphatic capillary, and this is what a lymphatic capillary looks like. So all these green lymphatic capillaries, they intersperse with the blood capillary. So within that area, there's going to be a flap mini valve located in these capillaries. The flap mini valve is where the lymph or excess fluid will then go through. Okay, so when they go through the lymphatic capillaries, now they're going to be pushed into the next level called the collecting vessels. So the collecting vessels are the next structure where they pass the interstitial fluid, or what we call the lymph, okay? And then all of these lymphatic vessels, they accompany blood vessels. They're always still located where the blood vessels are, okay? So whenever there's a blood vessel, lymphatic vessels follow it, okay? They follow them on its path, okay? They don't mix up with a blood vessel. They just follow the blood vessel. So this lymphatic vessel is also composed of the three tunics, similar to the blood vessel. Remember, the blood vessel has the tunica intima, the tunica media, and the tunica externa. The lymphatic collecting vessels have the same layers called tunics. And at this point, it contain more valves than the veins do. Okay, so the reason why there is a lot of valves here, similar to what we talk about the vein, they do not have pressure. So they need the push of the lymph going upward against gravity. So this helps direct the flow of blood. Now, lymph is propelled the same way as the veins by the bulging of skeletal muscles. So whenever you walk, you actually squeeze the veins to push the blood back to the heart. You also push the lymph to push it back to the subclavian vein. Okay, so this is pulsing of nearby arteries also allows this to be pushed up. Okay, and the lymphatic vessels has a tunica media that allows it to squeeze. Okay, so this is the structure of our collecting vessels. Now, the collecting vessels, when it receives the fluid, then it will go into the lymph nodes. So the lymph nodes are this marble-like looking structures, okay, that guards the rest of the body, and there's about 500 of them. They're the one that cleanse the lymph of pathogens. Okay, so hopefully the lymph node can do its job. So they cleanse it so that it doesn't reach the systemic circulation. Okay, lymph nodes are organized in clusters, and those are the ones that we will identify where those lymph nodes are. Okay, so once the lymph nodes takes in the fluid, it will cleanse any pathogen, and the only thing that it should actually allow to go through is your lymph, just the fluid. But apparently, sometimes some of those organisms can squeeze through, okay, and not be killed by the lymph node. And that is now going to be going from the lymph nodes. It then will go into the lymphatic trunks. Okay, so let's identify the lymph nodes first. So generally, you have 6 lymphatic nodes in your body. Okay, a couple of books would add up or would actually change the names. Okay, but these are the names that we're going to be using. So the first one is the lymphatic nodes. Okay, that is located at the neck. That is called the cervical nodes. Now, if you notice, it drains the face and the inside of the head. Okay, so whatever infection that you have located in the area of the face and to the head, it will be drained by the cervical nodes. So if you notice also that when you have an infection like a pharyngitis or a tonsillitis, once you have that infection, you can actually feel the nodes. They become tender and inflamed. That's going to be just under the mandible. So that are called cervical nodes. Okay, so they're doing its job. They're trying to filter out the organisms together with the lymph. So that's the first lymph node located just underneath the mandible, located at the neck. And that node is palpable. When you say palpable, you can feel it when it becomes inflamed. Okay, so that is palpable. Now, the next node, okay, is called the tracheobronchial nodes. So the word says tracheobronchial nodes. So it's located deep inside our thoracic cavity. So the nodes are located between the trachea and the bronchus. These nodes are called tracheobronchial nodes. Okay, so if you have an infection somewhere inside the thoracic cavity, such as your bronchi, if you have bronchitis, and then on the lung you have pneumonia, okay, all those lymph together with the organism will be drained by the tracheobronchial nodes. Now, this is not palpable. Okay, so the only way we can assess that the nodes are inflamed is when we do an x-ray, you can actually see that the nodes becomes opaque. So it will turn whitish. So that means there's an inflammation that's happening within the tracheobronchial nodes. Okay, so that's one node that is located inside the thoracic cavity. They're not palpable. So the only way you can see it is through a chest x-ray. Now, the third node is located in the armpit. Remember, the word armpit means axilla. So this is called the axillary node. It's just underneath the armpit, okay? So if you see the location of these nodes, they're the one that actually drains anything that comes from the arm, okay, forearm, and the chest. So this is superficial. So this is called the axillary nodes. Now, the location tells you that it is most likely the way the breast cancer will be drained into. That is called the axillary nodes. Okay, so the axillary nodes are located in the armpit, and they are palpable. Okay, they're palpable. You can feel those nodes. Okay, when they become inflamed. So it's doing its job. Okay, now the next node is located deep inside the abdominal cavity. That is called the aortic nodes. So it's located at the terminal end of the abdominal aorta. Okay, so any infection located within the abdominal organs, okay, will be drained by the aortic nodes. Okay, so any infection located in there will be drained by the aortic nodes. Okay, such as gastritis, any infection, your infection of the large intestine, small intestine, and any infection of the pancreas, everything will be drained by the aortic nodes. Okay. And again, you don't feel it because it's located inside. This is non-palpable. Call it not palpable. And the other one is called the iliac nodes, and these iliac nodes are located where the aorta divides. Remember, the division of the aorta is called the common iliac, okay, common iliac artery. So the area that guards the pelvic cavity is called the iliac nodes. Okay, so these are the nodes that will drain any organism or inflammation, infection, and lymph at the area of the pelvic cavity, such as your urinary bladder, the organs of the gonadal organs, and that is actually where those nodes will actually become drained. Okay, so the iliac nodes are deep, so they're also not palpable. They're not palpable. And the last nodes, okay, the general last nodes that we have that guards around the body will be the inguinal nodes. So the inguinal nodes is just located underneath the skin. So it is close to where the inguinal ligament is, okay? And these nodes are the one that will drain anything from the leg and thigh, okay, and the genital organs, okay? So that is where the lymph is going to be drained. So this is where we assess for sexually transmitted disease, STD. So if there's an STD or infection located in genital organs, it will then be drained to the inguinal nodes. Again, these nodes are superficial. This is palpable. You can actually feel it, okay? So that signifies that there's something happening between the genital organs or from the leg and the thigh, okay? So these are sentinel lymph nodes. Sentinel meaning it guards, okay? And that is actually the 6 nodes that we identified here, okay? So those are the 6 nodes we identified here. Those are the general 6 nodes that are guarding our body, okay? So after the lymph node, okay, let's take a look at your structures after the lymph node, okay? So we finished with the lymph node. So the next structure where it's going to be drained is now going to be the trunks, okay? The trunks are vessels before the ducts, and the ducts are the one that drains it to the subclavian vein, okay? So we generally have 5 major lymph trunks. After the lymph node, the trunks drain it, okay? And the 5 major trunks are called the lumbar, receives lymph from the lower limbs. We have the intestinal trunk. That's the one that receives chyle, okay? The fats that are being digested and absorbed through the intestinal tract, that's where they go, the intestinal tract. And then we have the mediastinal trunk, okay? They're the one that collects the lymph from the thoracic viscera. And then we have another trunk called the subclavian trunk, okay? They're the one that receives the lymph from the upper limbs and the thoracic wall. That is called the subclavian trunks. And then the jugular trunks, they're the one that receives the drainage from the head and the neck. So this is now at this level. We call it the lymphatic trunks, okay? There's 5 major trunks. So we're going to identify that in our anatomy. So these are the 5 trunks, okay? Remember, they're symmetrical. They exist on both sides, except for one. The 5th trunk, called the intestinal trunk, it only contains 1. So that is the one that will drain the absorbed fats from your intestinal trunk, okay? And that is the intestinal trunk. So let's take a look at the trunks. So remember, we just call it left or right, okay? But in this case, okay, I'm going to follow through first. This part here is where this duct connects, okay? That is going to be our duct, okay? That is a duct, and that is the next level after the trunk. Now, if you take a look at the drainage to the duct, those are your trunks, okay? So I'm going to change my color to purple so we can trace the trunks. Now, this is called, number 1, the jugular trunk. So the jugular trunk drains into the duct, okay? That is the drainage in the duct, same as here. That's your jugular trunk on the right side, okay? So that is the first trunk. Now, the next trunk that drains into the duct, we call it a subclavian trunk. So this is the subclavian trunk draining into the duct. Okay, and the subclavian is also located on the right side. Okay, and it drains onto the right side trunk. Okay, now the next one is going to be called the bronchomediastinal trunk. Okay, that's the one that located a little bit down at the thoracic cavity, entering into the duct. And that is called the bronchomediastinal trunk. Same here on the right side, the bronchomediastinal trunk draining into the duct. Okay, and then from here at the bottom, number 4, we have a lumbar trunk. So the lumbar trunk drains into the opening here on the duct, but take a look. Okay, it only drains here to a bulge located here. And this bulge is called the cisterna chalae. Cisterna chalae actually is considered as a duct, but it taps on, the cisterna chalae will tap on and connect to the duct onto the left side. Okay, so that is going to be called the cisterna chalae. Okay, and this is actually the thoracic duct, continuation of the thoracic duct, because the duct on the left side is called the thoracic duct. So the thoracic duct extends down, okay, into the abdominal area, okay, but the right, okay, will generally absorb also whatever it gets out from that duct and will also drain it into the duct here. That duct on the right side is called the right lymphatic duct. Okay, I'm gonna label as green, so you can see this is going to be the right lymphatic duct draining to the right subclavian. The left lymphatic duct drains into the left subclavian. Okay, so again, the cisterna chalae is actually considered like a duct. Okay, because what it does, it will take in the lumbar trunk, okay, from the abdominal organs down below the abdominal area, and then it also take in the intestinal trunk, okay? Only one of that, right? So this trunks will then enter to the cisterna chalae, and then the cisterna chalae will bring it to the thoracic duct, okay? And then from the thoracic duct, it now connects into the left subclavian vein, okay? And that is the two trunks that are located at the terminal end, the lumbar and the intestinal. Okay, only one for the intestinal, two in the lumbars. So that will be the last 4 of the trunks. The left lumbar, and you have a right lumbar, and only a single intestinal trunk. Okay, so the 5 trunks that we trace going to the ducts is called the left jugular, the left subclavian, the left bronchomediastinal, and then the left lumbar and the intestinal trunk. Okay, 5 of them, right? So after the trunk drains all the fluid from the nodes, okay, it will then go into the ducts. Okay, the duct is the terminal portion of this vessel. Okay, this lymphatic structures. So there's 2 of them, one from the right. This is called the right lymphatic duct. Okay, this is the one that enters in the right internal jugular and subclavian veins. So you could see that that duct, the right lymphatic duct, drains into between the subclavian and the internal jugular vein. Okay, so they're draining into those vessels, and remember, once it drains, it goes to the brachiocephalic vein, and then it goes to the superior vena cava, and then it goes to the right atrium. So now it's going to flow together with the circulation of the venous circulation back to the heart. And then from the heart, it's going to be pumped into the circulation after. Okay, so that's called the right lymphatic duct. Now, the thoracic duct is the one that enters into okay, the left subclavian vein. That is going to be your thoracic duct. And the reason why they don't call that a left lymphatic duct is because it is extensive. So the thoracic duct takes in the drainage coming out from the cisterna chalae, and the cisterna chalae takes in the lumbar trunks and the intestinal trunk. Okay, so this is a major drainage of duct, the left side called the thoracic duct. Okay, now the cisterna chalae is also considered as duct, but that it enters in the subclavian vein indirectly into the thoracic duct. The cisterna chalae connects with the thoracic duct, and thoracic duct connects into the left subclavian vein. Okay, so the cisterna chalae is a union of the lumbar, okay, trunks and the intestinal trunk. Okay, so that is part of the thoracic duct. So they consider this also a lymphatic duct. Okay, now if I go through your structures, okay, if you notice that in our model here, 1/4 of the body is colored green. Okay, this area is drained. 1/4 of the right semi-half of the body is drained by the right lymphatic duct. Okay, it's drained by the right lymphatic duct. But 3/4 of the body, okay, it's colored tan, is drained by the thoracic duct. Okay, and that's the reason why the thoracic duct is the one that drains almost the whole body. 3/4 of the body is drained by the thoracic duct. That's why we don't call it the left lymphatic duct, because it is extensive. Okay, 3/4 of the body is drained by the left duct, but we call it the thoracic duct. Okay, we call it the thoracic duct. And part of the thoracic duct is the cisterna chalae, which it actually drains at the thoracic duct. Okay, and that is the different vessels and structures that we are identifying in our anatomical structure. Okay, now if you take a look at the lymph nodes, okay, we'll do a review. So what are the lymph nodes made out of? There's 6 of them. It's called the cervical nodes. And then we have the tracheobronchial nodes. And then we have the axillary nodes. We have the aortic nodes. We have the iliac nodes. And we have the inguinal nodes. Okay, 6 of the nodes. Okay, and they're located symmetrically. So we got one on the right, one on the left. Okay, now for the trunks, okay, the trunks are made out of the jugular trunk, the subclavian trunk, the bronchomediastinal trunk, the intestinal trunk, and your lumbar trunk. So there's 5 of those trunks. Okay, remember they're symmetrical except for the intestinal trunk. There's only one. Okay, there's only one. And then your ducts, we have 2 major ducts, the right lymphatic duct, okay, and then the thoracic duct. But remember, the cisterna chalae is considered as duct, but they indirectly go to the subclavian vein, to the left subclavian vein, by attaching itself to the thoracic duct. Okay, so these are your anatomical structures that we're studying in the lymphatic system. We identify the lymph nodes, we identify the trunks, and then we identify the ducts. Okay, so that's a simple anatomy of the lymphatic system. Okay, so now we're going to take a look now at the lymphatic models. Okay, so again, that's the reason why it's actually very simple. Okay, we have not a lot of that information because most of the information that we get out from is going to be a part of the physiology, in which we study the immune system. Okay, and that is going to be in the physiology, right? Now, if you take a look at the models that you have here, these are the models that we use in our lab. Okay, so we see the cervical lymph nodes. Cervical lymph nodes is located underneath the mandible, just on the area of the neck. Okay, that's the cervical lymph nodes. And we also see the axillary lymph nodes. Axillary lymph nodes just underneath the armpit. Okay, and then we have the lumbar lymph nodes. Okay, now the lumbar lymph nodes is just similar to what we call the aortic nodes. It's just around the terminal end of the aorta. So this is what we call in our books aortic nodes. And then the one located inside the pelvic cavity, the pelvic lymph nodes. Okay, these are the iliac nodes. Okay, that we have in our models. Okay, so that is what we have in our book, iliac nodes. And the last nodes of that is going to be the inguinal lymph nodes. Inguinal lymph nodes is located where the inguinal ligament is. Okay, so that area is located here. Okay, so those are some of the nodes that are identified here. Okay, and remember, the only thing that we was not identified here is actually your tracheobronchial nodes. Tracheobronchial nodes are located between the trachea and the bronchus. Okay, and it's going to be your tracheobronchial nodes, because remember, we have 6 of that we studied. Okay, now this is the magnified area, and we're going to be identifying the ducts. Okay, the ducts, you see that this duct drains down into the right subclavian vein. So this duct is what we call the right lymphatic duct. Okay, so that is actually the right lymphatic duct. Okay, it enters down into the subclavian vein, right subclavian vein. Now the thoracic duct, that is a duct that enters into the left subclavian vein. The left subclavian vein. Okay, so those are the main ducts, right? And remember, I can see the cisternaceae deep down into the terminal end of the abdomen, and this cisternaceae will tap into the thoracic duct. Okay, so that will tap to the thoracic duct, and it's still part of the area of the thoracic duct. Okay, but the reason why we still consider it as a duct, because it drains the lumbar trunks and the intestinal trunk. Okay, we'll see that later on in our models. All right, now this one is going to be our other models with identification. Okay, so we have the lymph nodes first. So first you have the lymphatic vessels. These are vessels, and those are the vessels that drains into the lymph nodes. So we call it lymphatic vessels. So the first one is, okay, now the reason why I also took this out from the internet, so that you can actually understand that in the internet, some of them are not labeled right, okay? Some of them are not labeled right, okay? Such as this label here. So axillary node, okay? It's supposed to be in the armpit. This is the right label where the armpits are. But here it is located at the neck. So this label is wrong, okay? That's the reason why we don't trust, we don't trust our labeling if we get it from the internet, because the internet will actually have some errors, okay? So remember, this node located at the neck and below the mandible, this is what we call our cervical nodes, okay? Cervical nodes, right? Now, the ducts that we can see draining into the right subclavian vein, that's the right label. That's called the right lymphatic duct. And the duct drains to the left subclavian vein. That's correct label. That's called the thoracic duct. And remember, the thoracic duct is also connected to the cisternaceal line. So that's the whole thoracic duct here. Okay? And the inguinal nodes, you see it on the area close to the skin called the inguinal ligament. Okay? So those are the labels of the nodes. Remember, the spleen is also part of the lymphatic organ, okay? The purpose of the spleen is to drain the blood, okay, on our circulation. So any blood that is in our body will always pass through the spleen, because the spleen can still filter out any organism that's floating in your blood. And that is actually by the spleen, okay? It is considered as a lymphoid organ, such as your tonsils are your lymphoid organs, and the Peyer's patches located in your intestinal tract. Those are lymphoid organs. And remember, when we say lymphoid organs, you have those lymphocytes that are embedded into those lymph nodes. And that is the one for protection of any microorganisms that are actually trying to invade our body. Okay. All right, here now is just a picture of another model, okay? But generally, this is actually the model that tells you what veins are being tapped on. Okay, again, the right lymphatic enters to the right subclavian. The thoracic duct enters into the left subclavian, okay? That is actually where they drain into, right? Next. Okay, this now is a little bit of a magnified view of what we call the cisterna shalai. The cisterna shalai is this bulge that we have in the area close to the abdominal organs. And again, this is connecting into the thoracic duct. So this one connects to the thoracic duct. Okay, now what drains into the cisterna shalai? These are the lumbar trunks. The left lumbar, the right lumbar, and the intestinal trunk, okay? The intestinal trunk. So this is located at your abdominal cavity, the cisterna shalai. Again, another view of the model, okay? Now this is labeled correctly. At the neck, those are the nodes called the cervical nodes. On the armpit, those are the nodes called the axillary nodes, okay? And then we have some of the nodes called the mediastinal nodes. Again, that is the same thing as your tracheobronchial nodes. Tracheobronchial nodes. Okay. And then you have the right lymphatic duct entering to the right subclavian. That's a good label. And the thoracic duct entering to the left subclavian. That's the right label. Okay. And then we have the mesenteric lymph nodes. Okay. And remember, the mesenteric lymph nodes is what we call the aortic nodes. Okay, so the aortic nodes are the one that actually similarly called the mesenteric lymph nodes, which drains anything within our abdominal organs. Okay, so they're the one that drains into our abdominal organs. And then we have here the inguinal lymph nodes located at the inguinal area. Okay, there's a ligament there called the inguinal ligament. Okay, so those are the right labels. Okay, so the second look sound the magnified view, the location of lymph nodes, okay, and you should have our 6 lymph nodes, cervical, okay, and then we have on the armpit, axillary, and then between the trachea and the bronchi, tracheobronchial nodes, okay. And then we have the area within the abdominal. That's going to be your aortic. And then lymph nodes get at the pelvic cavity. Okay, that is going to be your iliac. And then the node located at area the inguinal. That is your inguinal. Okay, so we actually went through 6 of these nodes. Okay, so those are the 6 nodes. All right, so again, this is from the schematic diagram that we studied from, and those are the nodes that we studied: cervical, tracheobronchial, axillary nodes, aortic nodes, iliac nodes, and the inguinal nodes. Okay, those are the structures that we studied in our lecture. Okay, now this is a picture of the axillary on the armpit. So those marble-like structures are called nodes. They're the one that guards anything on the chest and from the upper extremity. Then we have the cervical nodes located in the neck and below the mandible. They're the one that drains anything from the head and to the face and to the inner part of the head. And then here's the inguinal nodes. The inguinal nodes are draining coming out from the lower extremity and also somewhere along the genital organ. Okay, they're being drained by the inguinal nodes. And then here's the tracheobronchial nodes. So the tracheobronchial nodes are draining anything within the thoracic cavity. Okay, And remember, one of the clinical aspects that you can actually take this information with is when somebody has a positive skin test for tuberculosis, it means the person was exposed to the organism called Mycobacterium tuberculari. Okay, but we have to identify if the patient has an active infection of tuberculosis. So the next step after a positive skin test is a chest X-ray. And on the chest X-ray, we should not see an enlargement of the nodes on what we call the tracheobronchial nodes, because if there's an enlargement of the tracheobronchial nodes, they will assume the patient has an infection of tuberculosis. Okay, and that's exactly what we look at on the chest X-ray, the tracheobronchial nodes. Right. Now, this is the thoracic duct. So it connects from the sternoculi up into the thoracic area where the thoracic duct is. So the whole structure here is called the thoracic duct, enters to the left subclavian vein. And this is the right lymphatic duct. And the right lymphatic duct enters to the right subclavian vein. Okay? And then here's the sternoculi, located deep in the abdominal viscera. That is the one that will connect with the thoracic duct, where the thoracic duct enters to the left subclavian vein. Okay. Okay, so respiratory system, okay. Remember, respiratory system is actually quite in a group of the cardiovascular, the blood vessel, and vascular system, because remember, the blood that is being pumped by the heart is going into the respiratory tract, okay? It is going into the respiratory tract, so it's a good group of topics that we included in the cardiovascular, vascular, in the blood, okay? Now, for your respiratory system, so the basic function of respiratory system is to supply the body with oxygen coming out from the lung, and we dispose the carbon dioxide that we get out from the tissue and then bring it back to the lung to be exhaled. And that's going to be the function of a respiratory system. So what are the structure of respiratory system? So I'm going to make it easy for you to trace the path of air, okay? Generally, air can be going through two cavities, the oral cavity and the nasal cavity. So those are the cavities where air can go in. And you want the air to go to the nasal cavity because on the nasal cavity, there's a lot of hair on your nasal cavity, and there's a lot of mucous membrane there that secrete mucus. So whatever dust particles is inhaled through your nasal cavity, it's going to be trapped through the mucous membrane and be filtered out by the hair on your nose. And that allows it to prevent it from going through deep down into the respiratory tract. Another thing about the nasal cavity, it has these blood vessels that surrounds the nasal cavity. So remember, blood vessels have blood that conducts heat. So whatever air is being taken in through the nasal cavity, it's going to be warm, okay? It's going to be warm and moist. And that is the reason why it's really good to breathe through your nasal cavity. And sometimes we abnormally open our mouth, we breathe through our mouth, okay? But the best place to bring the air from the outside is through the nasal cavity. So we got the two cavities, oral cavity and nasal cavity. And after that, these two cavities go into the next structure at the back of the mouth or the oral cavity. We call it the pharynx, okay? So we call it the pharynx. So we call it a P. And then after that, air goes into the E. Now, E is not an esophagus, okay? Because we don't want air to go to the esophagus. When it goes to the esophagus, it goes to the stomach. E is actually called the epiglottis. Okay, so the epiglottis is a protective structure located on top of the respiratory tract, close to the larynx, and this guards the food from going inside the respiratory tract. And we'll see that it looks like a pinball, a flipper with a pinball machine. Okay, so that will be the next structure where the air passes through the epiglottis, and then it goes to the L. L is called the larynx. Okay, so that's where the voice box is. So that is the next tube where the air goes. And then from the L, it goes to the T. T is now the windpipe called the trachea. And then from the trachea, the air now goes into the capital B. B is a tube that divides from the trachea. Those are what we call the bronchi. And then the bronchi becomes small we call it a small b, and these are called your bronchioles. Okay, and then after the bronchioles, it then becomes A. A is alveoli, and alveoli is the smallest sac where the air ends up into. Okay, so we call it alveoli, right? So if you follow the path of air from oral nasal to P, E, L, T, capital B, small b, and A, you just described the anatomy of the respiratory tract. So respiratory organs are nose, nasal cavity. Remember, the paranasal sinus is just within the nasal cavity. These are cavities molded inside the bones of the skull. Those are paranasal sinuses. And then it'll pass through the paranasal sinuses, and then it goes into the pharynx, larynx, trachea, bronchi, and the small branches are called the bronchioles. Okay? And then after that, it goes to the lung where it ends up into the small sac called alveoli. Okay? All right, so we're going to continue on. Okay? So we trace the path of air, and those are the anatomical structures, okay, that we laid out here to make it easy for you to memorize. Okay? So now let's take a look at the individual structures on this anatomy. Okay? So okay, so let's take a look at where the systems are. Okay, so I mentioned that air goes between the nasal and oral, O-N. Then it goes into the back of the mouth. That's going to be your pharynx, B. And then this part here, above the larynx, okay, is what we call the epiglottis. Okay, and that is going to be your letter E. And then after that, we have the voice box. That's going to be your letter L. And then the windpipe, after the voice box, the larynx is going to be your trachea. That is going to be letter T. And then the branches coming out from the trachea, that is going to be your bronchus, letter B. And then the bronchioles are going to be microscopic structures located inside. There are small tubes that are located inside the lung, and that's going to be your small b, and that is your bronchioles. And then another microscopic structure at the end of the bronchioles are the small sacs. That is going to be the alveoli. Okay, so we followed our mnemonics: on, pelt, B, capital B, small b, and A. Okay, and remember, when you hear the word conduction system, respiratory system, conduction system is actually the term that they use that the only thing that these tubes do is conduct air, okay? It conducts air. So air is conducted through the oral cavity and nasal cavity, and it goes to the pharynx, goes to the epiglottis, and then after the epiglottis, goes to the larynx, goes to the trachea, and then goes to the bronchi, and it goes to the bronchioles. Now, the bronchioles are so thin, the walls are so thin that it allows gas exchange. So conduction zone does not allow gas exchange. So the area where conduction system allows the gas exchange is now called the respiratory zone. So I'm going to divide the two bronchioles into a terminal bronchiole, okay, and a respiratory bronchiole. That's going to be a respiratory bronchiole. So what it means is the respiratory bronchioles, the walls of the respiratory bronchioles are so thin that it allows exchange of gases between the blood vessel and this tract. And that is actually still the two bronchioles that I mentioned. Okay. So terminal bronchioles, it only is a conduction zone. Okay. When it reaches the smallest bronchiole called the respiratory bronchiole, gas exchange can occur at that point. And then on the respiratory bronchiole, it then attaches into the alveoli, but you have the alveolar duct. The alveolar duct is a small tube that connects to the alveoli. Okay. So this is the specific structures in which the air goes through, because we got to divide the conduction zone into respiratory zone. So anything before the terminal bronchioles, all of this are called your conduction zone. And after that, the respiratory bronchiole to the alveolar duct to the alveoli, That is called your respiratory zone. So respiratory zone meaning gas exchange occurs. Okay, the gas exchange between the gases, the oxygen and carbon dioxide, and the blood vessel that is located in your respiratory tract. Okay, and they're the one that allows gas exchange to occur. Okay, so the nasal cavity. Let's take a look at the nasal cavity. The opening is called the external nares, or what we call the nostrils. It is divided by a septum. So the two nostrils are not mixing together. There's actually a division in the middle called the nasal septum. And remember, it is also part of the nasal pharynx. The area between between the nasal cavity and the pharynx, we term it the nasal pharynx. Okay, we're going to divide the pharynx into three parts later on. One of that is going to be the nasal pharynx. The opening at the back of the nostril is called the choanae, or what we call the posterior nasal aperture. So it's just an opening into the pharynx called the choanae, or posterior nasal aperture. Right, so this is a picture of the paranasal sinuses we looked before when we studied the skeletal system. These are cavities molded inside the skull, okay? And there's four of them. And these are cavities that has mucous membranes also, secrete mucus inside those cavities, but they exit out into the nasal cavity. So any mucous membrane that is produced here is exiting out into the nasal cavity. Now, if there's a blockage of this exit, okay, called meatus, okay, they suffer from what we call chronic sinusitis. So the blockage is causing them to fill up the sinuses, and that will produce congestion and pain, okay? So the four sinuses coming from the frontal bone is called the frontal sinus. The one coming out from the ethmoid bone is the ethmoid air cells, or the ethmoid sinus. And then one coming out from the sphenoid bone is what we call the sphenoid sinus. And the one from the maxillary bone is called the maxillary sinus. So here you see the cavity molded inside the bone of the frontal bone, frontal sinus. And these are air cells located at the ethmoid. We call it the ethmoid sinus. And then the one located at your sphenoid, that's going to be our sphenoid sinus. And on the maxillary bone, that is going to be the maxillary sinus. Okay, four sinuses, right? And air will pass through those sinuses, but it doesn't go inside those cavities. Okay, generally, it allows the way we speak. Okay, it actually produces phonation. So if you have those nasal sinuses clogged with those mucus, this is how we're going to be sounding like. Okay, this is where the nasal sinus are congested. Okay, and that is because it actually does not allow any echoing within those chambers. Right? So now take a look at the pharynx. The pharynx is the posterior part of the oral cavity. So at the back of the mouth, where the oral cavity is, that back is called the pharynx. It's a funnel-shaped passageway. It actually connects the nasal cavity and the mouth. Okay, and we will be dividing them into three parts. Between the nasal cavity and the pharynx, we call it the nasal pharynx. Between the oral cavity and the pharynx, we call it the oropharynx. And then between the larynx and the pharynx, we call it the laryngopharynx. Because within this division, we have to identify structures within those divisions. Okay. Now, these are different divisions. The oropharynx. Okay. Now, inside the oropharynx, between the oral cavity and pharynx, there's what we call tonsils. Okay. There's two tonsils that are located in the oropharynx. The one to the side of your mouth, in this area here, okay, that is going to be the side of your mouth, okay, and which is on the oral cavity. That is actually called the palatine tonsils. So the palatine tonsils is the one that you see on the side of your mouth. When you open your mouth, you see the tonsils to the side. That is called the palatine tonsils. Now, the tonsil located at the back of your tongue. The back of your tongue is adequately called the lingual tonsils. Lingual means tongue, okay? So those are the two tonsils that are located in the oropharynx. Now, in the nasal pharynx, there's actually about two structures that we're going to be identifying, okay? So the nasopharynx is between the nasal cavity and the pharynx. Okay, the oral cavity and the pharynx is there. Okay, that is going to be the oropharynx, and the nasopharynx is between the nasal cavity and the pharynx. Now, there's two structures that we would like to identify on the nasopharynx. There's a tonsil located here, a little bit on the superior wall. Okay, and between the nasopharynx, that tonsil is called the pharyngeal tonsil. So the pharyngeal tonsils is also called the adenoids. Okay, it's located in the posterior wall. Okay, and they protect pathogens from going into the oral cavity and located at the nasal cavity. And then there's another tonsil called tubal tonsils. These tubal tonsils are actually just located at the tubes. Okay, so they're interspersed along that area. Those are tubal tonsils. Okay, and then the last structure that we're going to identify there is actually this opening here, which connects the middle ear cavity. Okay, remember that is actually the cavity that can equalize the pressure between the middle ear cavity and the atmosphere. That is called the pharyngeal tympanic tube, or what we call the auditory tube. So recall on the senses, the middle ear cavity is connected into the nasal cavity through the pharyngeal tympanic tube. Unfortunately, the end of the tube is always closed. So in order to equalize the pressure, you got to yawn or swallow saliva. And you can actually feel that when you ride an airplane. So when you ride an airplane, sometimes you can feel a little bit of pressure coming out through the middle ear cavity because the pressure inside the middle ear cavity is different from the atmosphere. So the way to equalize that is to yawn or swallow saliva. And that will equalize the pressures from the atmosphere and the middle ear cavity. And that's located at the nasopharynx. Now, the last pharynx is called the laryngopharynx, between the larynx and the oral cavity. Okay, nothing much that are seen here, but you can actually see this structure called the epiglottis. Okay, it's curved upward because whenever the food goes into the oral cavity, it's going to push the epiglottis and cover the open respiratory tract, and then the food goes to the esophagus. Now, if you note that the esophagus is located at the back of the pharynx. Okay, that's why when you swallow, you have to lift your throat up in order to lift the esophagus also to grab the food. Okay, so this is the structure located at the laryngopharynx. Okay, so just identify the structures within those group or sections. Right, and then we have the larynx. Okay, function is for voice production and also for airway, and it also is a route between air and food that needs to be propelled in the proper channels. Okay, you don't want the food to go to the larynx because when it goes to the larynx, then it will go to the respiratory tract, and then somebody has to do a Heimlich maneuver to dislodge that food that goes to the respiratory tract. The superior opening is closed during swallowing, but it's open during breathing because remember, the epiglottis is curved upward, okay? So it's constantly open. But when you swallow food, it will be pushed down to cover that opening. And that's located in the larynx. And we got to identify a couple of structures within the larynx. We have a bone and cartilages there, okay? So the bone, if you recall, we studied this on the skeletal system. This is called the hyoid bone. And remember, the hyoid bone has muscles that lift it up and pulls it down, okay? And remember, the muscles that lift it up are called the suprahyoid muscle, and the muscles that pulls it down, we call it the intrahyoid muscle. What is connected with the hyoid bone is the next structure called the cartilage. This is called the thyroid cartilage, okay? So the thyroid cartilage is just beneath the hyoid bone, but it's connected to the hyoid bone through membranes called the thyrohyoid membrane. The thyrohyoid membrane. So again, a lot of people use the word Adam's apple as the whole larynx, okay? The only structure that's called the Adam's apple is this protruding part of the larynx. That is called the Adam's apple. But scientifically, we call it the laryngeal prominence. It is prominent more in the males and less on the females. Okay? And that's located at the thyroid cartilage. Now, the next cartilage below that, it looks like a ring, okay, is called the cricoid cartilage. So just beneath the thyroid cartilage is called the cricoid cartilage. And then after that, it connects now to the trachea. And the trachea has cartilage that wraps around halfway and more completely in the front. And those are called the tracheal rings. These are made out of hyaline cartilage, called the tracheal cartilage. And the purpose for this is to constantly have it open. So you don't want to collapse those trachea when you start breathing in and out, okay? It maintains the opening of the trachea. And that is at the end of the trachea will actually be the bronchi, okay? So the trachea descends into the mediastinum at the back of the heart, okay? It has C-shaped cartilage that keeps it open. And the word carina is just the place where the trachea divides into the bronchi. So the first division is called the primary bronchi. So this is your trachea. Now this is your first division of the trachea called the primary bronchi. Primary bronchi. Remember, it will divide 3 times, okay? Now the part where it starts to divide, at the end of the trachea, that is called the carina. Okay, it marks where the trachea divides into the primary bronchi, because we have to mark these structures, because when somebody uses a bronchoscope, you got to be guided on the structure where you are. Okay, so if you now reach into the trachea, the part that it ends and then divides into the bronchi, we call it a carina. Okay. And again, if you recall, the epithelium that lines the trachea is called pseudo-stratified ciliated columnar epithelium. It has cilia that allows the dust particles to be moved down, to be moved up into the throat, okay? Because remember, the cilia carries dust particles that you have to take in together with the air. The dust particles will be trapped at the mucus that is lining the trachea down to the bronchi, so that the mucus will be the trapping the dust particles and then push it into the throat. When all the mucus goes into the throat together with dust particles, then it produces what we call expectoration or coughing reflex. And that's the main reason for the cilia, okay? Remember, we're not a vacuum cleaner. So when the cilia actually become paralyzed, okay, because of the smoke from the cigarette smoke, and it will actually become stagnant, and the mucus will stay within the trachea to the bronchus, and those are the ones that suffer from what we call chronic bronchitis. Okay, all right. So this is what it looks like. This is your trachea. It has a cartilage that is half ring. Okay, it doesn't extend to the back. And what is connected to the back of the trachea is the esophagus. So that's going to be your esophagus. And then if you take a little lining of the trachea, okay, that is called pseudostratified ciliated columnar epithelium. So this is what the pseudostratified ciliated columnar epithelium looks like, okay? And that's a recall for our tissues. All right, so next, we're now looking at the bronchial tree. Okay, so the bronchial tree will divide, okay, into 3 parts. The first division is called the primary bronchi, called the main bronchi. Okay, that's the largest bronchi. Okay, but if you note the bronchi, the right bronchi is wider and shorter than the left. Okay, so if I draw a trachea into the bronchi, it's wider and shorter, and the left is a little bit acute in angle, and it is a little bit longer, okay? Now, the knowledge that you have to take with this is The reason why the left is actually acute in angle because the heart is located mostly on the left. So they actually produce this acute angle onto the left. Okay. So the straighter part of the bronchi connected to the trachea is on to the right. Okay. It's on to the right. Okay. So let's take a look now at our bronchi. So the first division from the trachea, that bronchi is called the primary bronchus. Okay. We call it a primary bronchus. After that, the bronchi now divides again. And the second division is called the secondary bronchi, or sometimes called the lobar bronchi. Okay. Now you would understand what lobar pneumonia means. Okay. So lobar pneumonia is located on the second division down to the alveoli. Okay. So that's the second division. Okay. And then the last division is called the third division or the tertiary division. And that is called your tertiary bronchi, but the name is called segmental bronchus. So the first one is main, second one is lower, third one is called segmental. Okay. And once the third branches off, then it now connects into the bronchioles. Okay. Bronchus are microscopic tubes after the bronchi on the third division. Now take a look at the area, the lobes of the lung. Okay, so the lobes of the lung on the right is made out of three. Okay, because it has two fissures. This is called the horizontal fissure. Okay, which only exists on the right, and this is an oblique fissure which exists on both. So you got right oblique and horizontal, and then you have a left oblique. Okay, no horizontal. And that's the reason why there's only two lobes of the lung. This is called the superior lobe, and this is the middle lobe, and this is the inferior lobe on the right. While on the left, you only have a superior lobe and an inferior lobe on the left. Okay. And if you consider anatomy, the reason why the left can only divide two lobes, and the reason for that is because the left side of the heart invades its area. Okay, so it can only divide into two lobes. Right. So we studied the second division called the lumbar bronchi. Okay, and then we studied the third division called the tertiary or the segmental bronchi. And then from there, it becomes the bronchioles. Okay. Remember, the bronchioles can be divided into what we call the terminal bronchioles, which is after the bronchioles from the tertiary bronchi. And when you hear the word terminal bronchioles, there's no gas exchange here. Okay. Because the walls are so thick that gas cannot diffuse in and out of the walls. Okay. In and out of the walls. Because remember, what's around the walls of the bronchioles are blood vessels. Okay, so terminal bronchioles is conduction zone, and then after that it becomes the respiratory bronchioles, and the respiratory bronchioles will lead into what we call the alveolar duct. The respiratory bronchioles after the terminal bronchioles leads to the alveolar duct and to the alveolar sac. At this point, respiratory bronchioles is called the respiratory zone. Okay, there's actually gas exchange can occur within these tubes. Okay, so this is what it looks like microscopically. Okay, so terminal bronchioles, and then after that it branches on to respiratory bronchioles. Okay, and then respiratory bronchioles will connect to the alveolar duct, and then alveolar duct will then connect to each of the sacs called alveoli. Okay, and that's where the air stops. Okay, at the alveoli, and that's called the alveoli or the alveolar sac. Okay, now take a look at another picture here. This is called the alveolar duct, and then after that it goes into the alveolar sac. Okay, each of this is your alveolar sac. So they enter into the alveolar sac, and the air stops within this sac, okay? Now, microscopic picture, you got the respiratory bronchioles, and then after that, you have the alveolar duct, and it connects to the alveoli or the alveolar sac, okay? And remember, the alveolar sac is thin wall. And if you notice, that surrounds the air, the respiratory bronchioles and alveoli are blood vessels. These are blood vessels, okay? These are blood vessels because that's where gas exchange will occur. Okay, now this picture shows you the blood vessels called the pulmonary circulation capillaries wrapping around the alveoli. Okay, remember, these are the blood vessels that came from the heart. So if you remember the schematic diagram, we have the right atrium, the tricuspid valve, the right ventricle, the pulmonary valve, and then goes to the pulmonary artery. Pulmonary artery will go to the lung and wraps around the lung, okay? So in that case, it's unoxygenated. So all these capillaries is actually the pulmonary artery to the lung and then the pulmonary vein to the left atrium, okay? So these are the capillaries of the pulmonary artery and the pulmonary vein. So the color represents that vessel. Remember, pulmonary artery is unoxygenated. So that is actually the vessel that's bluish. This is going to be your pulmonary artery. Okay, now it's going to be the capillary. Now the reddish vessel that you see here, it's oxygenated, and that's going to be your pulmonary vein. Okay, and that shows you that the heart is really in a group part with the respiratory system. Okay, because the pulmonary circulation, the vessels from the heart goes to the lung, and then gas exchange occurs within the vessel and the alveoli, okay? And that is why they're in a group of this topic. So this is now a picture, okay, of the alveoli. So this is your alveoli. That's the sac, okay? And the opening of the alveoli is called the alveolar duct. Okay. Now the alveoli is where the air that you breathe in and out will actually stop. Okay. Now around the alveoli are blood vessels that wraps around the alveoli. These are your blood vessels. And remember, gas exchange occurs between the alveoli and the blood vessels. So this is a magnified view of the blood vessel in the alveoli. So this is what it looks like in a magnified view. Okay. Now, if you notice that this is part of the capillary. This is the blood vessel capillary. The lines, the blood vessel, the capillary is your endothelial cells, which is simple squamous epithelium. Inside there is floating your red blood cell, okay? And together with plasma. Now, this is the alveoli, and what lines the alveoli is also simple squamous epithelium. Okay, and in between the two is called the basement membrane. So that's going to be what we call the basement membrane. So the barrier between the air coming out from the alveoli to go into the blood vessel is made out of 3 layers. The lining, the simple squamous epithelium lining the alveolus, the basement membrane, and the endothelium of the blood vessel. And that allows those gases to diffuse, okay? Oxygen goes from the alveoli to the red blood cell, and the carbon dioxide that's located in the plasma is ejected out, diffusing into the alveoli. And when the carbon dioxide goes to the alveoli, you exhale that breath. So you expel that carbon dioxide. When you inhale air, you take in oxygen, okay? So those gases can diffuse between this wall, okay? And this is what it looks like on your alveoli in the blood vessel, okay? Now, I just want to make note about 2 types of cells located at the alveoli. So the first type of cell is called type 1, okay? Type 1 is the simple squamous epithelium that wraps around the alveoli. The simple squamous epithelium that wraps around the alveoli. That is called the type 1 cell. The type 2 cell It is a cell located within the alveoli, and the purpose of that is to secrete surfactant. When you study physiology, this is very important. Surfactant secretes a little bit of fat called lipids, okay? And that lipids is to wrap around the walls of the alveoli so that it doesn't collapse when somebody breathes in and out, okay? So the sac is so small that if it doesn't have a surfactant, it will collapse the alveoli, okay? So that's very important about the alveoli. It has the two cells, one lines the alveoli, type 1, and the type 2 is a cell that secretes surfactant. So if you use it clinically, you'd actually notice that a baby that is born prematurely will have some problems about breathing because they were born prematurely, so they're not actually secreting surfactant yet, okay, on the type 2. So that's the reason why they have to be placed in an incubator, okay, because the alveoli are collapsed, okay? They're not actually opening when they breathe in and out. So some of them are collapsed. So we're just waiting for time for them to mature within the incubator so that the type 2 cells will start producing the surfactant, okay? And that is one consideration that you will have on premature babies, okay? They don't have the surfactant released by the type 2, okay? Now, in terms of the coronavirus, okay, what lines around the alveoli are these cells called the macrophages. Remember, macrophages are actually white blood cells. So they're the one that guards the walls in the alveoli for infection. So if the coronavirus enters through the alveolar duct to infect the cell of the alveoli, okay, because coronavirus needs to go inside your cell. What happens is that cell becomes infected and the macrophages will actually note it is infected, okay? So what would the macrophage do? It will actually secrete pus all over the alveoli. It'll actually secrete pus. So now the alveoli now is flooded with pus. So the walls become thicker between the alveoli and the capillary. And that's the reason why oxygen is not able to go through the walls. They won't be able to reach the blood vessel. So when a person is infected with the coronavirus, the pus will actually produce some gurgling sound on the patient's breathing, okay? And then there's going to be less amount of oxygen in the blood. So we can measure it by the pulse oximeter that we insert on their fingernails. So that tells me that this is how the pathogen will actually attack the respiratory tract from the coronavirus. So that is the reason why when you study about anatomy, you should study what is normal structures and what are abnormal structures from the pathology. So that explains why people that suffering from the coronavirus infection will have a lot of this pus that will prevent as a barrier for the gas exchange for the alveoli. So it's going to spread out to the different alveoli, okay? And then there's less amount of gas exchange into the alveoli to the blood. So you can determine that by using a pulse oximeter. So the oxygen saturation is going to be like 80%. You need like 94%, okay? So that's the reason why they have difficulty breathing. Now, the method of treatment for that is going to be pushing oxygen air into the respiratory tract, and that is through what we call the ventilator, okay? So the ventilator pushes air forcefully into the respiratory tract in order to push this oxygen through the barriers. So you're going to have pressure air pushing the oxygen molecules on the air so that hopefully it can actually go into the blood, okay? And that's the treatment that we do with people who had the coronavirus infection, okay? So again, anatomy is good to know the structures, but later on when you go to your medical field or your nursing field, you're going to need to explain why the patient has a low oxygen saturation in their blood. And that is actually the explanation. The macrophages will then dump their pus into the walls of the alveoli, thickening the barrier that allows the gases to go through. Okay? Simple as that. And that is what we call pathology. right? So the pathology is what we talk about when we talk about disease. And remember, you're going to be talking about that when you submit your research. Okay, so the alveoli surrounded by elastic fibers, interconnects with the alveolar pores coming from the alveolar duct, and internal surfaces are the free-moving macrophages. They're the one that protects your alveoli. Okay. Now let's now talk about the pleura. The pleura is the area where the lung is located at. It's on the bilateral side. Okay, bilateral side. Now, the membrane that covers the pleura, okay, is made out of two membranes. The membrane that covers the organ itself, okay. So this is a membrane that covers the organ, okay. And that membrane is called the visceral pleura. And then the visceral pleura will then go and wrap around the wall of the cavity of the lung. And that membrane is called the parietal pleura. Okay? The parietal pleura. In between the two pleuras is a cavity, and that is called the pleural cavity. Okay? Remember, there's serous membranes there that actually secrete fluid. Okay? And the purpose for that fluid is to prevent friction when the lung expands and collapses. Okay? When it expands, you're breathing air. When it collapses, you're expelling air. Okay, and that visceral fluid, okay, that is secreted in the pleural cavity prevents friction between the walls. Okay, and that is the double layered sac surrounding each lung, made of the parietal pleura and the visceral pleura, with the pleural cavity between the spaces between them. Okay, and let's take a look now at the structure of the lung itself. Okay, so we have terms such as apex, base, hilum, and root. Okay, so the apex of the lung is the superior portion of the lung. This is called the apex. Now the bottom portion of the lung is called the base. Okay, and the hilum of the lung is this indentation to the side of the lung. Okay, that is called the hilum. So that's the indentation of the medial side of the lung. And remember, that's where the pulmonary artery enters, the pulmonary veins exit, okay? And then also the bronchi enters, and that's called the hilum, okay? And the roots are actually where it starts at the hilum, okay? So that's actually the area where all those vessels, blood vessels, and bronchi is located there, okay, that enters and exits out from the hilum. That's called the root. Left lung is a fissure called the oblique fissure, and it only divides into an upper and or what we call superior and inferior. And that fissure is called oblique, and the right lung has two fissures, the horizontal fissure and the oblique fissure. That's why we divide it into a superior, middle, and inferior. Okay, so those are the lobes of the right lung, right? And then the vessels that we talk about that wraps the alveoli are the pulmonary arteries. They're oxygen-poor blood, okay? And the pulmonary veins, they're oxygenated blood, okay? You see it wrapping around the alveoli like a net, okay? And we identify that the pulmonary arteries are blue because it's unoxygenated, and the pulmonary veins are reddish because they're oxygenated. And they're innervated by sympathetic and parasympathetic and some sensory fibers. And the purpose of the parasympathetic is to constrict the airway, and the purpose of sympathetic is to dilate the airway, okay? So that's the autonomic nervous system, okay? And this is on the top view of the thoracic cage. You can see that the pulmonary artery, they're the one that enters into the lung, divides into a right and a left. And the pulmonary veins, that's a red vessel, they're the one that exits the lung, and we have the right and the left, okay? right and left. And we notice that the pulmonary veins is made out of 4 vessels, 2 on each side, right? So and that is actually what we call the root, where the vessels enter and bronchi enters. Okay. Now, the area where the control of the respiratory system is actually coming out at the medulla oblongata. That is where breathing is maintained. Okay. If you notice that when you actually sleep, you don't have to think about it. Your body actually goes into its reflex mode. Okay. So whenever the brain sends an elevated amount of carbon dioxide in the blood, the brain says, inhale. Okay. So when you hear when the brain sends an increased carbon dioxide, the brain will stimulate the autonomic nervous system and the respiratory tract to inhale. When you inhale, the only thing that it will do is actually innervate the diaphragm muscle. The diaphragm muscle is dome shaped. Okay, so when the diaphragm muscle contracts, it will then flatten, become horizontal shape, and it will expand the lung. So that is what the diaphragm muscle do. Once the diaphragm muscle relaxes, it's a passive process. It becomes dome shaped again. So it's going to push the air out from the lung. That's for exhalation. And the control is actually happening at the medulla oblongata. We call it the VRG, ventral respiratory group. That's where the control is going to be. Okay. VRG, ventral respiratory group at the medulla oblongata. Okay, so this is where the control is going to be at the medulla oblongata. Okay, and remember, it also innervates the diaphragm muscle and the muscles between the ribs, called the intercostal muscles. Okay, those are the muscles that helps in inhaling and exhaling. So that is the process of respiration. And you're going to do a lot of these physiological concepts when you go to physiology, okay, in which it will tell you about how the brain, the medulla oblongata, controls respiration. Okay, all right. So that's a simple anatomy of the respiratory tract. Okay, the respiratory system has all those tracts. Let's now go to the models now. Okay, this is going to be the last part of our class. Okay. And then after that, you got a lot of time to take a look at the pre-tests for the respiratory and the lymphatic, and also the lymphatic respiratory lab exercises. Remember, I already gave it to you as question and answers. You don't have to submit them. You just have to study them, okay, for that exam. Right, so now let's take a look at respiratory models. Okay, we're looking at the nasal pharynx here, between the nasal cavity and the pharynx, this area here. And then the structure that dangles below the soft palate, that is actually called the uvula. Okay, remember the roof of the mouth is made out of the hard palate and the soft palate. That's the roof of the mouth. What dangles below the soft palate is called the uvula. Okay, let's take a look at this structure. And remember, this structure, we've actually used this on the brain, but we're going to concentrate here onto the respiratory system, okay? So we're dividing this structure into 3 parts. The nasal pharynx, between the nasal cavity and the pharynx, the oral pharynx, between the oral cavity and the pharynx, and the laryngopharynx, between the larynx and the pharynx, okay? So the structures that are located in your nasal pharynx is called the pharyngeal tonsils. Okay, that's going to be the pharyngeal tonsils. There's another structure that we have to identify there also. That is the pharyngeal tympanic tube. Pharyngeal tympanic tube is a structure that opens the middle ear cavity into the nasal pharynx. Okay, and then after that we have the oropharynx. The oropharynx is the one that's located onto the side of the mouth. Those are going to be called your palatine tonsils. Okay, the uvula is not part of it. So the one on the side of your mouth, that's going to be on the palatine tonsils, and at the back of the tongue, that is called the lingual tonsils. Those are the ones that you see in the oropharynx. And then what you see on the laryngopharynx is just a structure that is like a flipper or pinball machine, and that will be the epiglottis. Okay. Now let's take a look at another identification of this organ: the nasopharynx, the oropharynx, and the laryngopharynx. And remember, at the back of the laryngopharynx is where the esophagus starts. The esophagus is located just the back of the larynx. Right now, this is a picture of your throat, okay? Remember, we got to identify cartilages and bone. So the top part here is going to be the hyoid bone, okay? That's going to be your hyoid bone. The bottom is called the thyroid cartilage. We're looking at the posterior view, okay? Because I'm seeing the epiglottis, okay? So the bottom is called the thyroid cartilage, okay? And this structure, it looks like a flipper with a pinball machine. That is called the epiglottis, okay? And then after that, you see the opening down to the trachea. The name of that opening is just glottis. It's a hole that opens up to the trachea. And then there's actually a cartilage here below the thyroid cartilage. And that cartilage is called the cricoid cartilage. Okay? And then after that, you have the trachea with the tracheal rings. Okay? Now, there's other cartilage that I want you to identify also. Those are the cartilage at the ear where the voice box is. Okay? These cartilages are called arytenoid. Okay? Arytenoid. So you won't see it as cartilage because it's covered by membrane. So you won't be able to see it inside the throat. It's just like skin over it. But underneath that is going to be the cartilage called arytenoid. Okay? It's arytenoid is the one that is wrapping around the glottis. Okay, those are the arytenoid. Okay, and then let's take a look at some of the models again. From here, we see the thyroid cartilage. Then we have the cricoid cartilage. And then after that, on top of that, it's going to be the hyoid bone. Okay, on top of the thyroid cartilage is the hyoid bone. And then from there, you can see the thyroid gland wrapping around between the cricoid down to the trachea. This is actually called the thyroid gland. And then the windpipe below is going to be the trachea. And this will be the lung, okay? This will be the lung. So the lung only has two lobes on the left by the oblique fissure here. So we only have the superior and inferior. And then on the right side, you have the oblique fissure and the horizontal fissure. So we got three lobes. I'm going to change my color. And we have the superior, middle, and inferior. Okay, and this would be your diaphragm muscle. So the diaphragm muscle is muscle below the base of the lung. Okay, right. So now we see that the heart is inside the middle portion of the lung. Okay. And remember, this area here is called the mediastinum. So if you notice, the lung is like a cloak. It wraps around the heart like a cloak. Okay, and the vessels coming out from the heart is going to be the blue vessels is pulmonary artery. And these are the blue vessels, pulmonary artery. And then the red vessels is the pulmonary vein, oxygenated on the pulmonary vein. Okay, now next is going to be the trachea and the bronchi. The windpipe divides in the bronchi. Okay, that's going to be the trachea and the bronchi. And then here is another picture of a lateral view. Okay, and you can see that we have the nasopharynx here. This is the oropharynx, and this is the laryngopharynx. Okay, and if you take a look at the nasal cavity, you can see this ridges located to the walls of the nasal cavity. These are what we call conchas. Conchas are just like the wings of an airplane. So when you breathe in air, it directly pushes down into the respiratory tube. So those are called the conchas. And then we have the sinuses molded into the bone. Okay. This would be the frontal. Okay, and this should be the ethmoid. That is the one that's visible right now on this picture. Okay. All right, and let me actually go back a little bit because I need to identify those two structures that are here at the nasopharynx. This hole connecting the middle ear cavity is called your pharyngotympanic tube or auditory tube. And then you got tonsils here located at the posterior wall of the nasopharynx. That's called your pharyngeal tonsils, okay, or what we call adenoids. Okay, and then here you can actually see the palatine tonsils located at the oropharynx. And then at the back of the tongue is the lingual tonsils located at the oropharynx. And then here is going to be your epiglottis located at your laryngopharynx. And this will be your vocal cords. The vocal cords, okay, is within the larynx. That's the one that produces sound, okay? So generally you have two types of vocal cords. The one on top is false. And the one on the bottom is through vocal cords. So the one that actually produces sound is the true vocal cords. Okay?